So good morning, my name's Tanya Collin-Histed and I am the CEO of the International Gaucher Alliance. I'd like to take this opportunity to say thank you to Özlem and her team for inviting me as a representative of the IGA to be part of this event. For the next 20 minutes or so, I'm going to talk to you about how we, as a global organisation, representing 56 members that are from 54 countries around the world, have worked in partnership with stakeholders to support our patients during the COVID-19 pandemic. So these are my disclosures. So the learning outcomes from the presentation today will be that you will be able to recognise the value of global patient organisations and the role it plays, to recognise the importance of having an established multi-stakeholder community approach, and to recognise the vital role that national patient organisations have played during the pandemic. So as a global voice, our members look to us for guidance and information from a global level, whether this is from the companies that provide treatments or from the clinicians that are experts in treating Gaucher patients. As the pandemic took hold, we saw our role as one of providing information and support, recognising that each of our national member associations have access to different resources. Our aim was to provide one message from the clinical experts on how vulnerable patients were, and to be able to, for them to be able to ask questions. We therefore worked in partnership with the European Working Group on Gaucher's disease, and although European is in the title, their members are from around the world, to set up a Zoom call so that clinicians and patients could dial in and share information and ask questions that could be fed back to support their communities. As an organisation, we wanted to make sure that there weren't mixed messages given to patients, and that medical advice was given by those experts and treating doctors who knew about Gaucher's disease. Following this call, at the request of the International Gaucher Alliance, the EWGGD published a statement on which patients were vulnerable, and the minutes of the call were made available to all of our members who maybe had not been able to attend. And on the screen, you'll see our latest newsletter that we send to all of our members and to anybody interested in the community. So COVID has come at a different time in countries. Its impact has been different, and governments have approached it in a different way. And because of this, we were aware as an organisation that our members were working very hard in their own countries to support patients in the best way they could. So our approach, we decided, was had to be to support at a high level. So what did we do? So each of our board members, we have 9, are responsible for a number of our members. So they individually reached out to all of our members to do a welfare check, to ask how they were, what was going on in the situation, and a report was made on each country. And we then took this information where we felt that there were best practices that we could share with other members and put this in a document and sent this around to all of our members. So for instance, one of our member associations, their patients have treatment at home, but they have to go to the local hospital to get the treatment, but they weren't allowed out. So the National Patient Organisation, together with one of the pharma companies, organised transport to pick up the treatment from the local hospitals and deliver it to patients' homes so that they would be able to have their treatment. Other organisations organised online chats to do check-in for mental health and welfare and to be able to answer any questions. And we were able to share all of this information. There were many common themes that came out of the reports from all of our members, and some of these we felt that it was our role to take forward. So a lot of them wanted to know about who was vulnerable, and this is where we reached out to the experts through the European Working Group on Gaucher's disease and asked for a statement. Patients were obviously very worried about the supply of treatment. Would there be a shortage? Would the treatment be able to come into their own country? So we reached out at a global level and asked the global teams at the pharmaceutical companies to give us statements, which we then shared with our community to reassure them. We also asked the pharma companies to make sure that their local representatives contacted the national organisations to see if they were okay and if there was any work or support that they could give. And we know that this has been a tremendous help. One of the biggest challenges for our community has been access to treatment. Many of our patients don't have home therapy and have to go into hospital to receive their fortnightly infusions. Obviously, with many of the hospitals around the world coping with COVID and emergency care, this wasn't possible. So many of our patients either decided to because they didn't want people coming, they didn't want to go into hospitals maybe where it was necessary, where it was possible, but many patients weren't able to, so they had to take treatment breaks, which obviously has been a very anxious time for people to understand how that would affect their clinical health. What national patient organisations have done here is that they've worked with their own doctors to ensure that doctors have introduced video calls and online opportunities to chat, to check in, to see how they are and how their clinical health is at this time. Because of the challenges of access to treatment, the availability of home care, home treatment has been a big topic that all of our members have talked about. We know in some countries, home treatment is allowed and is very successful. For instance, in the UK, where I'm based, around 99% of our patients who are on enzyme replacement therapy receive their infusions at home. However, we do know that this is not the case in many countries, and there are many barriers, including legal and financial barriers, that mean that patients don't have access to treatment. And we felt that this was something that for now, for the COVID-19 pandemic, but also for the future, is something that we should try and support. So we decided to pull together a home therapy webinar for all of our members. This was advertised on all of our social media platforms and within our membership, inviting people to join us. We also allowed others to come in. We had some representatives from industry. We decided to invite two of our members from Italy and Greece who had had some success and were fighting for home treatment in their countries to actually present on the webinar. And our members were then able to ask questions. And as a result of this, there was a great collaboration in sharing documents where things had worked, sharing experiences where things had been maybe not worked. And all of the people that attended the webinar were then contacted afterwards, and all documents were shared with them. So going forward, one of the biggest challenges with access to home treatment in countries is there are legal issues and financial issues, and also issues for doctors that don't have the experience. So the IGA, at a virtual meeting of the European Working Group in Gaucher's disease in May, we challenged and made a call for action to the EWGGD to develop guidelines for home therapy for Gaucher patients. And we feel that having these guidelines that we can then share with our members, they can then share with their respective doctors and governments, will help patients be able to develop home therapy projects in their country. With our commitment to one message, we also work with the European Haematology Association. So together with the EHA, the IGA and the EWGGD and other gaucher experts, we produced a response paper. And the response paper has outlined the anticipated risk to patients and what could be done to reduce that risk. This paper was developed as a resource to support haematologists in the field who maybe aren't experts but do treat Gaucher patients. In addition to this response paper, we're also undertaking a survey amongst our members to really understand the impact on patients during the COVID-19 pandemic, particularly in areas like mental health, access to services and symptoms. And we hope to, we will be publishing this. So as an organisation, a global organisation, we believe that a united approach has worked really well and has supported our community during this pandemic. We know that many lessons have been learnt. There is much talk about a second spike, and I think we've learned a lot. Maybe we understand the risks more. Maybe we'll be better prepared to support our patients clinically in terms of their health, but also to support their mental health. So I'd like to say thank you for giving us the opportunity to present, and here's how to claim your CE credit. Thank you.